President Muhammadu Buhari on Wednesday inaugurated the new ministers who would be working with him in the next 4 years. He appointed 2 ministers to run the Ministry of Health. Osage Hanire is the senior minister, while Olarunimbe Mamora is the Minister of State. And now with me in the studio is Dr. Okulaja. He is a medical expert and he joins me now to look at the task ahead of the new ministers. He is also the Director, Advocacy and Communication, Farm Access Foundation. Thank you, Doctor, for joining me.
Thank you very much for having me.
Okay, so we have new ministers. First and foremost, what are your thoughts on the selection?
Well, I think my personal thoughts on the selection of the ministers are irrelevant and inconsequential.
You think so?
Yes, I think what is most important, because a lot of times we've been excited about appointments of ministers and we've had very high expectations of what they're going to be able to deliver, but we've been very disappointed at the outcomes. And so I think what is most important and what I am very keen on now is to hear the direction that the minister will be taking the ministry to in trying to provide equitable, quality and affordable healthcare for all Nigerians. It's very important because we see over the last 4 years, Nigeria has done very badly in health, and there's a need for a targeted approach to trying to solve the problems that plague the healthcare system.
Mm-hmm. So, having said that, what would be your general assessment of the previous ministers who were there in the health sector?
Well, again, you see, my general assessment as a person might not be too relevant because, again, it might be very subjective because you might not know the handcuffs that are on the ministers in their ability to deliver their mandate. But what I can say is that, you know, the healthcare system did not see a lot of attention in terms of being able to deliver the expected outcomes. Nigeria has the highest maternal mortality burden in the world. We have the highest in a lot of things, neonatal mortality, NCDs. And so, and again, you look at the coverage of health insurance in the country, it has been and still is very poor in terms of the ability for people to have the purchasing power to access healthcare services. And so I would say over the last 4 years, we've seen a great stagnation in the progress of healthcare in Nigeria.
Mm-hmm. So now that you have established that, what do you think, which areas should be their focus, key focus, to take a look to channel all their energies in the health sector?
You see, one of the most important things that I think is we should focus on is how we can find domestic resource mobilization for healthcare. You see, because one of the major issues that we have in the healthcare system is inadequate funding. And if you look at governments and you look at the ability for governments to sustain providing healthcare for people in Nigeria, it's quite not sustainable. You look at how much Nigeria made as a country last year versus how much they expected to make. There was a over 5 trillion naira deficit, which Nigeria then had to borrow. And so there's a need for the country to begin to look for concerted efforts to find other alternatives for mobilizing resources into the healthcare and then putting them in a targeted approach at solving issues. One of the major ways that we have been championing as Farm Access Foundation is health insurance, because we believe that a prepayment mechanism can facilitate and support the ability for people to access healthcare when they need it. But this prepayment mechanism must be a private-public partnership in the sense that people must be able to contribute to a pool and governments must be able to also subsidize for those that cannot pay in terms of creating a system that mandatorily compulses everybody to pay into this scheme for health insurance.
Mm-hmm. Having said that, now you talked about the hospitals, you talked about insurance also. What would you say would be the best approach to, having to have better public hospitals for us in Nigeria?
Again, if you look at the availability of funds for governments to revitalize these hospitals. I mean, you look at last year, and you look at the allocation to health from the budget, it was very poor. It was about, I think, between 3 to 4%. And again, it's not just the allocation. You look at the performance of that allocation in terms of the amount of money that was actually released. It was also quite not satisfactory. But beyond that, you find that majority of those funds are actually used for recurrent expenditure, which is to pay for salaries, to pay for consumables, and very little money is available for capital investments in terms of infrastructural development. However, you have a very vibrant private sector that is very keen on partnering with governments to revitalize these hospitals and deliver services under a health insurance scheme. And so I think one of the ways that government should begin to look at in bringing up these facilities in light of the dwindling funds that we have, is viable private-public partnerships.
So on the final note, you talked about insurance and partnership. Some people still don't understand the health insurance, and people, once you hear insurance, you feel it's very, very expensive. Are you saying to us it's something that is affordable, that people can begin to look into?
You see, again, insurance it depends on the pool that you're contributing to. Okay. If you have fragmented pools, which means that you have different pools that people are contributing to, of course insurance will be expensive. But if you have a single pool, so for example, one of the things that we have tried to propagate are states' health insurance schemes, where everyone in a state is expected to contribute to a single pool. If that kind of mechanism happens, then the amount of monies that need to be absolutely contributed to that pool will be significantly reduced, because a lot more people are contributing, and so the pool is bigger and is stronger and able to purchase services at cheaper rates. And so, yes, if everyone keys into state health insurance schemes that are being propagated, currently we have about 30 states that have passed their laws to set up their state health insurance schemes. However, we also have difficulty in a lot of these states in actually starting up the implementation of the schemes. And this is where I see the role of the federal government coming in and supporting states to see how they can inject funds to operationalize the schemes and drive people from the private sector to also contribute into the pools to deliver healthcare services.
All right, many thanks, Dr. Olamide, for your thoughts there. We're happy to have you come in.